If you are over 40 and actually concerned about your heart health, you're actually not alone. See, many people in their 40s, even to 60s, start to actually experience heart problems such as irregular heartbeats, palpitations, and high resting heart rates. I know that for a fact because I was one of them, and 9 years ago at age 35, I was actually rushed to the hospital with severe heart issues. My resting heart rate was a staggering 130 beats per minute, and I was suffering from atrial fibrillation, tachycardia, and arrhythmia. It was a freaking terrifying experience, and the doctors told me I needed surgery. And as I laid in the hospital bed, something didn't actually sit right with me. The freaking doctors didn't even bother asking me about my lifestyle, diet, or even exercising habits. They didn't even mention that my weight was 20 pounds over. They didn't even ask about my alcohol intake or if I was under a lot of stress. And it seems all they're looking for is to fix the symptom and not the underlying cause. So I knew I had to take matters into my own hands. I declined the surgery, of course, and decided to do some research on my own. And what I discovered was actually an eye-opening. I learned that many heart problems, especially in older adults, can actually be caused by electrolyte imbalances. And electrolytes are essential minerals like potassium, magnesium, calcium, and sodium that actually regulates your heartbeat and keep your nervous system functioning correctly. So when you're low in these minerals, it can actually lead to all sorts of heart issues. And the problem is that many people over 40 are actually deficient in electrolytes without even realizing it. See, as we age, our bodies becomes less efficient at actually absorbing these minerals from the food we tend to eat. Additionally, stress, anxiety, poor diet, and certain medications can actually all deplete our electrolyte levels. Even if you eat a freaking healthy diet, you may still be lacking these crucial nutrients. And the problem is with the standard blood test often don't detect electrolyte imbalances. The tests only measure the level in your blood, not in your cells where they're needed most. So you could have a normal blood test result but still be 100% deficient. And the only way to be sure is to get a specialized intracellular test, which is a bit expensive and not widely available. So the question is, what can you do if you suspect you might be low in electrolytes? Well, the easiest way and most effective solution is to actually take a high quality electrolyte supplement. Look for one that actually contains all four major electrolytes: potassium, magnesium, calcium, and sodium. Make sure it's coming from a reputable brand and has been third-party tested for purity and potency. So in my case, I started taking an electrolyte supplement that actually contained both potassium and magnesium. Within just 3 weeks, my heart problems had completely disappeared and my resting heart rate was back to normal, and I no longer had any palpitations or arrhythmias. It was a remarkable turnaround. But I did not stop there. I knew I needed to make some lifestyle changes as well, so I started by cutting back on processed and hormonal foods, which can actually deplete electrolytes and contribute to heart problems. I also switched my diet to more carnivorous, which uses a clean source of meat, are natural, rich in these minerals. Foods like a grass-fed, grass-finished beef, lamb, beef liver, and heart for organs. And once in a while, I started adding sweet potatoes and pomegranate, as they are an excellent source of potassium. I also did not have to actually make an effort to lose weight. Just by eating what was meant for our bodies to thrive was perfect. I noticed a lot of less stress on the heart, and overall mood changes was incredible. And another important factor in heart health is, of course, stress management, because chronic stress can actually deplete your electrolyte levels and thus contribute to heart problems. So to combat this, I started taking L-theanine of 200 milligrams twice a day, with practicing relaxation techniques like deep breathing and grounding. And I also made sure to get plenty of sleep each night, which is essential for heart health. So if you are over 40 and concerned about your heart health, I urge you to take action today. Seriously, don't wait until you end up in the hospital like I did. Start by taking magnesium ionic chloride, as it's packed with trace minerals and balanced electrolytes. And don't just take it once a day. Take it every 3 to 4 hours to actually saturate your cells correctly and not just your blood serum levels. And remember, taking control of your heart health doesn't have to be freaking complicated or expensive. Just simple changes like taking an electrolyte supplement, eating a balanced diet, maybe losing weight if you have to, and managing stress can actually make a huge difference. And if you need a specific medical treatment, don't be afraid to ask questions and advocate for yourself. You know your body best, and you have the right to make informed decision about your care.